This is Abdul Saad, clinical psychologist at Vital Mind Psychology here in Sydney, Australia. And today I come to you with a short new series focusing on panic attacks and panic disorder. My website is vitalmind.com.au, and also you can check out my Facebook page. Just search Vital Mind Psychology. So what I hope to achieve in this short series before we wrap up the year is to shine a spotlight on the experience of panic attacks, helping you understand the difference between a panic attack and panic disorder. But I also want to go a bit deeper than that and look at some of the childhood origins, potential childhood origins of panic, some of the personality traits that are associated with panic, and some of the mechanisms, underlying psychological mechanisms that can increase the likelihood and chances of panic. And these are mechanisms which are quite rarely discussed or acknowledged in the the videos that are out there and the articles that are out there online regarding panic attacks and panic disorder. And I also want to touch on the physiological aspect of panic and some of the ways that we can understand that using an approach which looks at the mineral balance within the body that can often be very helpful in treating panic attacks and panic disorder. So in this first video, what I want to do is just give a very basic introduction to what is a panic attack and quite a powerful model for understanding what actually happens during a panic attack. So to begin with, a panic attack is a brief episode of intense fear, which often can be triggered out of the blue, that is, there is no apparent trigger, or it could be in response to an identifiable trigger or stressor, such as being in a crowd, being in a crowded line, being in a bus, being in an elevator, etc. And during this episode of intense fear, which usually reaches its peak within seconds to minutes, upwards of about 3 to 10 minutes, the individual experiencing this very intense and very condensed episode of horrific anxiety, terror, experiences a number of physical as well as mental or cognitive symptoms. Now, physiologically, what happens during a panic attack is a massive activation of the fight-flight system or the sympathetic nervous system. So this will create symptoms like heart palpitations, sweaty, shakiness, tremors in the hands, wobbly legs, feeling like they're going to give way, shortness of breath, dizziness, nausea. Some people can experience, feelings of choking. And these physiological symptoms come on very suddenly and are very intense. And obviously, if you are experiencing these symptoms, especially if they're happening out of the blue, that will trigger a whole host of cognitive or psychological symptoms. And these are basically thoughts that accompany a panic attack. So thoughts of impending doom. I'm going to die. I'm going to have a stroke. I'm going to collapse. I'm about to faint. And another common one is also a fear of going crazy, a fear of what is actually happening to me. Am I going mad? Am I going to lose my mind? Am I going to lose control over my bladder, over my bowel? Am I going to make a fool of myself? So there's a whole host of cognitive symptoms that can occur during a panic attack. Now, it's very important to underline that a panic attack in of itself, the experience of a panic attack, is not a mental illness, it's not a disorder. A panic attack is simply an experience. Yes, it's an experience which is out of the ordinary for what we would normally want to experience in our everyday life, but nonetheless, it is an experience. And a panic attack becomes a disorder, it becomes panic disorder, when the fear of having more panic attacks, the fear of recurrent panic attacks, begins to rule the person's life, and the person begins to avoid previous activities because they fear that this could trigger panic. So basically, in panic disorder, a person's lifestyle begins to be severely affected because that person begins to modify their lifestyle, begins to avoid certain activities because of the fear of recurrent panic attacks. So for example, people may, simple things like they may give up drinking coffee, they may stop exercising, they may avoid going up a flight of stairs, they may avoid being anywhere where it's difficult to escape. And that's a separate, you could say, diagnosis or label that we can give that called agoraphobia, which very commonly co-occurs with panic disorder. So agoraphobia simply is a fear of being somewhere where it's going to be difficult for you to escape, a fear of having a panic attack in that location. So it could be being stuck in a crowd, in a queue, in a supermarket, on a bus, on public transport, on a train, etc., in a tunnel. Now, the model that I like for understanding panic at the level that I've explained it, at the symptomatic level, comes from a therapy tradition in psychology called CBT, or cognitive behavior therapy. And for all of its weaknesses, for all of its shortcomings, when it comes to treating panic disorder, CBT actually can work really well, especially if we get in early, shortly after the person has had their first panic attack. They've been medically cleared by a doctor or by the emergency department. So it's clear you're not having a heart attack, it's panic. If we can get the person in very early, soon after that, and get them to do a course of cognitive behavior therapy, CBT for panic, we can often, as we say, nip the panic in the bud before it gets any worse and develops into other anxiety problems, depression, etc. So in terms of the CBT model of panic, how do we understand it? Basically, a panic attack begins with a trigger. Now, the trigger might be internal or external. So a trigger could be a thought, a trigger could be someone feels their heart race, or it could be external. They're in a crowded supermarket or mall, they're stuck in traffic. Sometimes the trigger is not obvious. It can be outside of conscious awareness. So there's a trigger. From that trigger, there is a perception of threat. That perception of threat leads to a feeling of anxiety. And basically, when that feeling of anxiety hits, that triggers the fight or flight system. So that's the part of the nervous system which is triggered in response to the perception of danger. So I often explain to my patients who have panic that the mind is the master and the body is the slave. And if the master is saying there is danger, the body, as a dutiful servant, mobilizes and marshals all of its resources to help you deal with danger. And the way it does that is by activating the fight or flight system, or the sympathetic nervous system, which activates all the physiological symptoms I spoke about. So there's a trigger, there's a mental perception of threat, and the body says, right, kick into gear, activate the fight-flight system. Now, the key thing that happens after that is, after the fight-flight system is activated in a panic attack, there is what we call the catastrophic misinterpretation of those bodily symptoms. So the person who has a panic attack is catastrophically misinterpreting the meaning of those symptoms. So heart racing is interpreted as a heart attack. Tension around the head could be interpreted as I'm going to have a stroke. I'm going to die. So there's a catastrophic misinterpretation, and through that catastrophic misinterpretation, that creates even more adrenaline, more stress hormones, which feeds back into more anxiety and more fight-flight activation. So the person enters into a vicious cycle. As a result of that cycle, essentially the person with panic develops a fear of their own physiological symptoms. So panic basically becomes a fear of fear. The person becomes fearful of having another one of these awful episodes. Now, in CBT, we want to work on a number of areas. One, we want to reduce the physiological hyperarousal of the sympathetic nervous system. In simple English, what we want to do is, when the person is having panic, the set point for the activation of the fight-flight system has become lowered. And in a future video, I'll go into some of the reasons why that's the case. But basically, it takes less stress, less of a trigger to activate that system. So what we want to do in treatment is reduce the physiological hyperarousal by increasing the set point, so the person can tolerate more stress without the fight-flight system getting activated in a false alarm way. We also want to, of course, reduce the fear of bodily sensations. And the way that we do that is we might simulate some of those symptoms the person experiences during a panic attack and get them to understand that those symptoms do not mean impending doom, catastrophe, or death. Just back to the way that we deal with the physiological hyperarousal, how we can increase the set point for the triggering of the fight-flight system so it's not so easily triggered. There's a combination of things: diet, lifestyle, sleep, and especially in my clinic, we focus on the person's mineral profile, and that will be a topic of a future video in this series. We also want to, as part of a comprehensive treatment of panic, help the person reduce any avoidance and what we call safety behaviors they have been engaging in, which in their mind reduces the chance of having another panic attack. So avoidance could be avoiding things like, as I said, exercise, climbing stairs, drinking coffee, getting on a bus, riding in a car. And the safety behaviors are things that the person does because they believe they reduce the chance of a panic attack. It might be carrying a water bottle, carrying anti-anxiety medication in their pocket, etc. The reason why we want to reduce these is if the person continues to engage in avoidance and safety behaviors, they attribute not having a panic attack due to the avoidance and safety behaviors. So they never get a chance to learn that even without the avoidance or safety behaviors, your worst outcome is highly unlikely. So what I suggest, if you suffer from panic attacks, and if you suffer from panic attacks and this is something that you've recently had happen to you, or maybe it's something you've been struggling with for a while, is to do a bit of research and look into the therapeutic potential of a short course of cognitive behavior therapy or CBT for panic attacks or panic disorder. In my practice here, we can usually pretty successfully treat a straightforward case of panic that's just started, that isn't complicated by a whole bunch of personality issues or long-standing depression. We can knock it on the head within around 6 to 10 sessions, okay? If the person is motivated, they're engaged, and they're willing to follow through with the treatment. CBT for panic is less effective if there's a lot of other complexities along with the panic, like personality vulnerabilities, chronic depression, and this is where you need more long-term treatment that looks at a number of other factors. Okay, so I hope that was helpful in grounding us in, what is a panic attack, understanding it, understanding the CBT model, because in the next video, I want to look at a topic which is seldom explored, and that is the early childhood experiences and personality traits that can set people up for having panic attacks in adolescence and in adulthood. So I look forward to catching you sometime soon, pretty sure next week, for this video as we wrap up 2017 on YouTube for Vital Mind Psychology with this short series. Okay, thanks for watching, and if you like the content, please subscribe. Take care.